to the SLTV. This video was created from a full-length article on our health website. I will drop the link to the article in the description box. After watching, please make sure you like, share, and subscribe. And please do not forget to come back for more. See you soon.
Welcome to This Explainer. Okay, today we're looking into a connection that is honestly quite surprising and literally life-saving. You know, we usually tend to think of our oral health and our heart health as two completely separate universes, but what if I told you the simple act of taking care of your teeth was actively protecting your heart? Seriously, it is. Let's dive right in.
Part 1. The Hidden Heart Threat.
To really wrap our heads around this connection, let's look at a medical mystery that plays out every single day. We'll call her Mrs. A. So, Mrs. A has been smoking for 20 years. When she brushes her teeth, her gums bleed pretty easily. But like so many of us out there, she just ignores it. It's no big deal, right? Well, wrong. By ignoring those bleeding gums, she's unknowingly giving harmful bacteria a free pass to just multiply right there in her mouth.
And that sets off a rapid, incredibly dangerous chain reaction. Because she ignored the warning signs, those bacteria, they don't just stay in her mouth. Nope, they actually enter her bloodstream. And once they're in, they trigger systemic inflammation all throughout her body. Add in the fact that she continues smoking, and plaques start forming in her blood vessels. Those bacteria literally lodge themselves right inside those plaques, actively worsening her heart health. It's basically a massive domino effect.
Which brings us to a staggering number, 1 billion. That is a billion with a B. Mrs. A is definitely not an isolated case. Roughly 1 billion adults worldwide have severe gum disease. To put that into perspective, if you're in the US, that's about 40% of adults dealing with some form of it. This is a massive, completely hidden threat to global heart health.
Moving on to Part 2. Anatomy of the infection.
Let's zoom in a bit on this biological highway that connects your mouth directly to your heart. First, let's get our terms straight. Gum disease is basically an infection and the resulting inflammation that attacks the tissues supporting your teeth. This destruction is driven by the bacteria themselves, or, and this is kind of wild, by your own immune system's overreaction to them. If you let it go unchecked, it slowly eats away at the bone until, well, the teeth just fall out. So here's the exact mechanism of how this threat operates. Your mouth naturally has bacteria, right? And everyday things, brushing, flossing, or literally just chewing your food can push them into your blood. But if you have gum disease, the amount of harmful bacteria is just off the charts. Once they hitch a ride in your blood, they trigger the release of inflammatory cytokines. These cytokines go on to damage your blood vessels and contribute to atherosclerosis, which is the clinical term for plaques forming in your arteries. And that's a straight-up direct path to a heart attack.
All right, Part 3, the ripple effect.
Because, you see, the damage isn't just a straight line from point A to point B. It creates a massive ripple effect throughout your whole system. Think about it. Advanced gum disease makes your gums super painful, which makes chewing tough foods a total nightmare. So what do? They stop eating those heart-healthy, crunchy fruits and vegetables and swap them out for softer, heavily processed, nutrient-poor foods. At the end of the day, your heart is literally starved of the essential nutrients it needs to keep pumping strong.
And it also plays off other conditions, making everything worse. Take diabetes, for instance. It is a seriously dangerous two-way street. On one hand, diabetes promotes inflammation, which shoots your risk of gum disease way up. But on the flip side, the chronic inflammation from that gum disease simultaneously blunts your body's response to insulin, actively jacking up your risk of type 2 diabetes. They basically just feed right off of each other.
Which brings us to Part 4, warning signs and risks.
Let's make this super actionable for you. Who is really in the danger zone here? Well, smoking is an absolutely massive risk factor. But if you combine that with high blood sugar, poor oral hygiene, or a lousy diet, you are severely increasing your chances of developing advanced gum disease. Even things like aging and obesity naturally tip the biological scales against you. And here is the really tricky part. Gum disease is notoriously silent. The damage is often happening in the background without you feeling a thing. But listen, if you notice redness, swelling, or bleeding when you brush, that is your body sounding a loud alarm. If your gums are actively pulling away from your teeth, receding, or if you have persistent bad breath, also known as halitosis, you need to get that checked out immediately. Those are major red flags.
Finally, Part 5, protecting your two systems.
Now for the good news. You have the power to easily intercept this biological threat. Seriously, taking care of your gums literally protects your heart. It's as simple as brushing for 2 minutes twice a day, floss daily, brush your tongue, and definitely use fluoride. If you smoke, it's time to quit, try to cut back on the alcohol, and for the love of your heart, don't skip your annual dentist visit. These really simple, everyday habits stop the infection right at the gum line, long before it ever gets the chance to reach your bloodstream.
So, let's wrap this up. A healthy smile? It's not just about looking good in photos. It is fundamentally tied to your cardiovascular survival. Your heart is quite literally depending on your toothbrush. So let me leave you with this one question. When is your next dentist visit?
Please subscribe.